Dialogue with a Doctor, featuring one of Southwest Florida's leading gastroenterologists, Dr. Raymond Phillips of Gastroenterology Group of Naples.
Welcome to our show. Well, Dr. Phillips, thanks for coming on the show again, and just want to tell everybody you've treated our family, everyone in our family, so you've done a wonderful job. But besides that, tell everybody about yourself.
Well, I appreciate that. Thanks so much, Jim. Thanks for having me back again. And yeah, I'm a gastroenterologist. I'm an expert in digestive diseases and liver diseases. And what that represents is a long accumulation of education. I went to college at Princeton on an ROTC scholarship. I went to medical school in St. Louis at Washington University. Then went on to do my internal medicine training at Jefferson Hospital in Philadelphia, and I was chief resident there. And at that point, I went on active duty and was assigned to Fort Leonard Wood, Missouri as an internist. I was selected for gastroenterology training at Walter Reed, and then after I completed my training in gastroenterology, I was selected to be on staff where I did research and saw patients. And in the 1990s, after I got out of the Army, I came on down to Naples, and we developed a practice of gastroenterologists. I worked with Dr. Gustavo Rivera, Dr. Rafael Urbina, Sandra Haro, as well as Dr. Susan Lebersky. And we have offices in Naples and Colonial Square, as well as on Marco Island and Bonita. So yeah, we're experts in the GI system, everywhere, everything from the mouth down to the other end, and within the GI tract, the liver, pancreas, etc. So. And
what's your logo? What's your saying there?
Well, our unofficial motto is we work where the sun don't shine, but that's just a reflection of where we do our work.
So I know you wanted to talk about inflammatory bowel disease. What's new in 2008? That's what you wanted.
And inflammatory bowel disease, this is really exciting stuff. I'm talking about Crohn's disease and ulcerative colitis, which are very, very common and more frequent across the United States as each year goes by. And across the entire world, it's becoming more frequent and seems to be a reflection of expansion of Western culture and Western foods across different parts of the world, so that there's no ethnic group that's not involved with this. And for years, we've been very, very limited on the capability of treatment, to the extent that we only had steroids or another anti-inflammatory called sulfasalazine. The modern day derivatives are Lialda, Dipentam, Azicol, as well as Pentasum and others. But for years we'd been limited until about 15 years ago with the advent of certain types of drugs called biologics. And you see them advertised every night on television, Humira, Remicade, Entyvio.
That's right.
These are that represent the culmination of years and years of research in the immune system and understanding how the immune system is involved in causing ulcerative colitis and Crohn's disease. Now, with our greater understanding of how the immune system is what provokes and maintains and causes these conditions, with our better understanding of the immune system, we've been able to develop more selective medications that can control the immune system, at least where it manifests its inflammation in the GI tract. So that's why right now you're seeing such a proliferation of new medications. And I've mentioned a couple of the names, not so much to promote them, but just to say that they represent the culmination of years and years of research. And now it's really exciting for us, because now we have really effective medications that can put people in complete remission, so that they feel perfectly well. And if we can intervene in a timely way, that is to say, when they first develop symptoms in the first year, we can prevent these conditions from leading to major surgery and operations that have been the other means of treating these conditions in years past. So it really is an exciting time for us. The difficulty is that now we have these greatest medications in the world that are really effective in the sense like 70, 80, 90% of people will respond. And if one medication doesn't work, we can use another one. Now we have all these things, but now there's increasing sort of concern by patients saying, I'm not sure if I want to use these medications. One, they're really expensive, and the other is that there's increasing concern about patients that because these medications are so well studied, their symptoms and side effects are so well known, and they're promoted so well on television, people are fearing the complications and side effects and not appreciating the benefits it can give them. So the reason why there's so many side effects and unknown about these drugs is they're among the best studied ever produced and by science, and as a consequence, we know a lot about them, but those side effects are capturing our patients' attention and making them reluctant to make the decision to move ahead sometimes.
So how long does it take to research a drug like that? How long were the research done? 10 years, 15 years?
Yeah, to go from an understanding of the immune system to the culmination, the production of the prototype Remicade in 1999, 2000, it took like 20 years of research. But now the process is really accelerating in these last 18 years. The reason it's accelerating is now we have much better understanding of the immune system. We have so many techniques now that allow us to rapidly do the basic science that we're able to rapidly gather this information. And now we're on the edge, the cusp of 30 or 40 new medications that can be available. The trouble is that so many of these medications look so promising, but there's only each of these medications has to go through phase 1, phase 2, phase 3 studies and supervised by the FDA before they can meet approval. And getting individuals to participate in these studies is increasingly a problem. And now that we have such a proliferation in drugs, they're competing for individuals to participate in these studies. It's the more the holdup now is just getting individuals to enroll in these studies so that we can get more meaningful results. And it's kind of there's a little bit of funny perspective from the American consumers. They feel like, well, these drugs that are on the market are being approved and being sold, that somehow they just materialize. All of those drugs currently have had to go through these different phases of studies. They had to have volunteers participate in these study programs to make them available. And it's not like they just materialize without the participation of individuals who have, who've volunteered their time and efforts to allow these studies to be successful. So, anyway, so I'm putting a plug in there for research and for patients for participate in clinical research. 2
questions. Do they tell you the percentage of side effects for different things?
Absolutely.
It does.
And absolutely. And that's the part that seems to be overlooked in these promotions on television. They'll mention a kind of cancer called lymphoma, and once you hear, hey, a cancer, people are like, well, I don't want to use that drug. But because colitis and Crohn's disease is an inflammation of the immune system, there's already a stimulus to the immune system. So individuals who have these conditions already have an increased rate of lymphoma as it is, like 2 in 10,000. If you take one of these medications, it can increase your risk to 4 in 10,000. So on the face of, oh, that doubles my risk, that's terrible. But that's like 2 seats in Germain Arena going up to 4 seats.
Right.
So the risk 4 in 10,000 is extremely low. But nonetheless, it's still a risk, but we take far greater risks just getting our car each day and going to work. So it's just, the notion is it's worthwhile to identify the risk and be aware of it, but to put it in context, given the overall health of and the illness that a person has.
And one more question, is the FDA moving up the drugs, before they can get on the market, or sooner they can get on the market? Was there some talk
Well,
about
yeah,
that?
yeah. Oh,
Because
yeah.
in Europe
There's
certain,
more of a time. Yeah, in the 1980s and 1990s, I practiced during that time with the HIV epidemic.
Right.
The FDA was like, well, we've got to do our studies and
Right.
we've got to go through these phase 1, phase 2, and 3 studies.
Right.
It'll take 10 years to culminate. Well, all these people were dying in 6 to 12 months' time
That's right.
from HIV, and so there was tremendous criticism of the FDA for being too slow in the pace of production of these medications in the setting of people dying from an ongoing epidemic. And so as a consequence of that, they have increased the speed of approving medications and even providing an opportunity for fast-tracking certain medications for illnesses that are particularly devastating in terms like hepatitis C and so forth. So it can speed up the approval process. So instead of taking decades, it can just take years now. And so that's been a consequence. One of the fortunate consequences of the HIV epidemic is that the FDA's modified its approach to approval of medications so that it can be sped up and it can be a little more efficient, although still nonetheless extremely expensive and time-consuming to achieve. But you want to have safe medications. You want to have confidence in the medications that are available. So I think it's a balance between the two. So.
Well, thank you for coming on the show, and that was a very interesting topic.
Oh, thanks so much for asking me,
Hope you come
Jim.
back again
Oh,
soon,
I'll
okay?
come back again, Jim. Absolutely.
Okay.
Thank you so much.
Thank you. Thank you.
Are you in need of a gastroenterologist in the Naples, Marco Island, or Bonita Springs area? Dr. Raymond Phillips of Gastroenterology Group of Naples, along with his fellow physician associates, are board certified in gastroenterology hepatology and one of the most respected medical practices in Southwest Florida. Hear it from one of his patients directly.
I've been a patient of Dr. Phillips for myself personally the last 20-25 years. He's treated my family, my extended family, my friends. I never mind coming here because it's a very friendly place and everyone here makes me feel that way. They're so caring. And Dr. Phillips, I get a chuckle out of him because everywhere in his building it says, "We work where the sun don't shine."
With the medical industry changing so rapidly, Dr. Raymond Phillips offers the newest technology and treatments in his field. If you're looking for a practice that is attentive and will address all your questions and concerns, call Dr. Phillips' Naples office today for an appointment at 239-649-1186.